Good afternoon, and welcome to an update from the National COVID-19 Vaccine Consultative Committee on the next steps in the rollout of the COVID-19 vaccine in the Bahamas. Today, I'm joined by the Chief Medical Officer, Dr. Pearl McMillan, and Dr. Nakia Forbes on Zoom. Dr. Danny Davis is here with us. He's our data management consultant at the Ministry of Health. Dr. Frank Bartlett from Grand Bahama. We are now experiencing a significant increase in new cases, in the number of hospitalizations and deaths from COVID-19 at a time where there is increased travel to and from the Bahamas. Genomic surveillance has identified samples with a predominance of the Alpha variant co-circulating with others in the Bahamas. We are now awaiting the results from 100 samples taken in July and August and sent this weekend to the Fiocruz Research Laboratory in Brazil. It is anticipated that we will receive the results by the end of this week and will be able to confirm if other variants, such as the Delta COVID-19 strain, is in the Bahamas. Ladies and gentlemen, our healthcare system is overwhelmed. The morgue at Princess Margaret Hospital is full. On August the 13th, we recorded 158 newly confirmed cases of COVID-19. Of that number, 119 cases were recorded on New Providence, 4 on Grand Bahama, 24 on Abaco, 1 Bimini, Catkey, 7 on Eleuthera, 2 on the Berry Islands, and 1 new case in Andros. This brings the total number of cases recorded in the Bahamas as of the 13th of August to 16,430. There were 142 COVID-19 patients at PMH, including 13 in the intensive care unit. Sadly, on that day, a new death was recorded, bringing the number of COVID-19 deaths to 313, with 39 deaths still under investigation. In the last 2 weeks, the Bahamas has been very fortunate to receive a significant boost to our COVID-19 vaccine supplies. On the 3rd of August, we received 33,600 doses of the AstraZeneca vaccine. This is the third tranche of prepaid vaccines secured through the COVAX facility with the assistance of the Pan American Health Organization. We have 19,240 of these doses remaining at this time. Just this past Thursday, the Bahamas received 128,700 doses of the Pfizer vaccine donated by the government of the United States. The Bahamas was among the first group of Caribbean countries to receive the donation from the United States. This was facilitated through CARICOM and the Caribbean Public Health Agency, or CARPHA. This generous donation is the first in a series of batches. Over the coming months, the Bahamas is expected to receive a total of 397,000 doses of the Pfizer vaccine as a part of this significant donation. Today, I'm pleased to report that the Bahamas has been notified that in this coming week, it will receive 34,400 doses of the single-dose Johnson & Johnson vaccine. With our current supplies and the vaccines that are in the pipeline, we now have an opportunity to significantly accelerate our vaccination program. Last week, we were able to reopen 3 additional vaccination centers on New Providence. This allowed us to administer a total of 8,858 doses of the COVID-19 vaccine during that period. 61%, 5,446, accounted for the first doses, and 39%, 3,412, accounted for second doses. We are pleased to see that Bahamians and residents are turning out in large numbers to receive this life-saving vaccine. As our supplies have increased in recent weeks, so has the demand. Over the next week, there are 7,514 appointments already booked. This includes 4,603 or 61% first doses and 2,911 or 39% second doses. This represents 96% of the appointment slots available online up until Friday of this week. Now, during the week of the 23rd of August, we anticipate that a total of 17,100 appointments will be available. Our goal is to fully vaccinate 60,000 Bahamians and residents over the next 6 weeks. We encourage you to regularly check the vax.gov.bs website for available slots for first and second doses of the vaccine. We will review the vaccination dashboard. Since the start of our national vaccination program, we have administered 117,380 doses of the vaccine in the Bahamas as of the 14th of August. The total number of fully vaccinated people is at 51,150. This includes Bahamians and residents who have been fully vaccinated abroad and have registered on the vax.gov.bs portal. We've been fortunate that all of our islands and keys where people reside have had the opportunity to be vaccinated with at least 1 dose of the vaccine. We know that residents of the Family Islands are eager to learn when vaccinators will return to administer second doses and more first doses of the vaccine. From the AstraZeneca supplies that remain, second doses continue to be offered in New Providence and Grand Bahama. Family Island residents who've already received a first dose of AstraZeneca will be offered a second dose of the same vaccine. I'm happy to report that we have secured the infrastructure to accommodate the safe and secure transportation of the Pfizer vaccine to the islands. And we are grateful to all our partners who have contributed to this accomplishment. To accommodate the planned rollout of the Pfizer vaccine, more vaccination centers will be added on New Providence, we hope in Grand Bahama as well, and the Family Islands in the coming days and weeks. However, we note that there will be additional requirements for technical, physical, and human resources to ensure the delivery of this vaccine. The recommended interval between doses of the Pfizer vaccine is 21 to 28 days, quite distinct from that of AstraZeneca. This will allow us to fully vaccinate more people at a quicker rate. The Pfizer vaccine is available to everyone 12 years of age and older. Now, just as we did with the AstraZeneca vaccine, before we begin administering Pfizer to the general public, we will carry out an assessment of the administration of the vaccine with an already selected group of adults and children 12 and over. This will take place tomorrow, Monday the 16th of August. On Thursday, the 19th of August, we will begin administering the Pfizer vaccine to the general public at the Kendall G.L. Isaacs Gymnasium. The Kendall Isaacs Gym Vaccination Center will be the only site administering the Pfizer vaccine on Thursday and Friday this week. The public may begin booking appointments tomorrow, Monday, August the 16th, starting at 3 p.m., and this will be for the Kendall Isaacs Gym. The Loyola Hall, St. Anselm's, Bahamas, and Church of God Vaccination Centers on New Providence, and the Susan J. Wallace Community Center on Grand Bahama will continue to operate this week to accommodate appointments to receive the AstraZeneca vaccine. You see the schedule posted there. As part of the push to get as many shots in arms as quickly as possible, the Kendall Isaacs Gym, Loyola Hall, and Malia Vaccination Centers on New Providence will also be open over this coming weekend on Saturday, the 21st of August, and Sunday, the 22nd of August. Pfizer vaccine will be offered at all of the weekend sites. On Grand Bahama, an assessment of the administration of the Pfizer vaccine will be carried out this coming weekend, followed by a full rollout the week of the 23rd of August. Family Island residents should pay close attention to the schedule updates in order to make appointments as soon as they become available. Visit vax.gov.bs to book your appointment online, or visit one of the walk-up centers to book an appointment. Vaccination schedules can also be found at opm.gov.bs and the Ministry of Health's Office of the Prime Minister's social media platforms. Schedules are posted weekly and will be updated regularly. We will provide more information about the administration of the Johnson & Johnson vaccines in the coming days once the vaccines have arrived in country. Of note, the Bahamas supports the position of the WHO's Strategic Advisory Group of Experts, SAGE, this group on immunization, which advises that countries can consider administering a first dose of the AstraZeneca vaccine, followed by a second dose of Pfizer, particularly in situations of interrupted supply. Studies have shown that offering a first dose of the AstraZeneca vaccine, followed by a second dose of Pfizer, offers strong protection against the COVID-19 virus. If you have received a first dose of the AstraZeneca vaccine, you will be able to book Pfizer as a second dose. The interval between AstraZeneca and Pfizer regimen will follow the recommended guidelines. If you have received a first dose of the Pfizer vaccine abroad, you may receive your second dose of Pfizer in the Bahamas. However, you will be required to present proof of vaccination of the first dose and present both vaccination cards to prove full vaccination status. You will be asked to register your vaccination status on the vax.gov.bs portal to be counted in the national vaccination numbers. At this time, we will not be offering a third dose of the vaccine. School children need to be protected to facilitate safe in-person learning. Previously, only teachers and school staff were eligible to receive the vaccine. With the arrival of the Pfizer vaccine, which has been approved for use in children 12 to 17, we now have the opportunity to vaccinate some school-aged children. If a parent or guardian wishes their age-appropriate child to be vaccinated, they may make an appointment starting as early as Monday, the 16th of August. Parents will be required to fill out a consent form during the appointment-making process. Children 12 to 17 years of age must be accompanied by a parent or legal guardian to the vaccination center. The parent or guardian will also be required to show an ID. A working group is being proposed as part of the Vaccine Consultative Committee to ensure ongoing access to the vaccine by both public and private school students. This working group will be made up of key stakeholders and representative groups. More information will become available on this initiative as the Ministry of Education prepares for the safe reopening of schools in the next few weeks. Currently, we are fortunate to have an adequate supply of COVID-19 vaccines. Now, we must significantly increase our vaccination rates, while at the same time, we must take personal responsibility and follow the public health measures. Over the course of the vaccination period, we continue to receive a number of questions that contribute to vaccine hesitancy. These include concerns about the fast-paced development of the vaccine, a risk of blood clots, harm to your genetic makeup, interference with fertility. All these concerns have been put to rest by scientific reports, and I want to assure you that there is no evidence to support these concerns. Most recently, global recommendations support the vaccination of pregnant women and those who plan to become pregnant. I want to share with you a recent finding. Yesterday, a newborn, born on the 12th of August, tested positive for COVID-19. This is the second reported case of a newborn testing for COVID-19. These are the youngest case reported in the Bahamas. We know that vaccines save lives. According to data collected by Dr. Forbes and her team at the Princess Margaret Hospital, between the 14th of March 2021, at the start of vaccination program in the Bahamas, and the 31st of July 21, 411 patients were hospitalized with COVID-19. Of that number, 400 of 411 were unvaccinated. 11 were partially vaccinated. No fully vaccinated persons were admitted to PMH for care during that period. Of that same period, 53 COVID-19 deaths were recorded. And we know this is an underestimate. But 52 were unvaccinated and one was partially vaccinated. There were no deaths recorded among fully vaccinated persons during that time. Conclusion: the best way to protect ourselves and to prevent more surges is to get vaccinated. We know that health protocols work. It's important that everyone, the vaccinated and the unvaccinated, continue to follow these protocols. When you leave your house, wear your mask indoors and outdoors and make sure it properly covers your nose and your mouth. Continue to wash your hands thoroughly and frequently. Keep a distance 6 feet from others when you can. And an appeal to avoid large gatherings. Do not gather in large groups. I cannot stress this enough. Do not gather in large groups. We want our children to safely return to school and have in-person learning. In order to do that, we must practice individually and collectively all of the protocols. We must also take full advantage of the opportunity to be vaccinated as quickly as possible. We need all age groups to fully participate in this effort to return, young and old, to return to our normal lives as quickly as possible. Together, we can combat this pandemic. Before I close, I wish to speak to my professional medical colleagues. Today is a sad day. We have 3 unvaccinated healthcare workers, 2 physicians and a nurse, who are currently hospitalized with COVID-19. Prior to coming here, I was informed of the death of an unvaccinated physician who died of COVID-19. I wish to express my condolences to the physician's family. And I say to my professional health colleagues, in our profession, we practice according to the science of medicine. We know now that there is no scientific merit to claims that the vaccine is unsafe. It is the responsible role of healthcare professionals to become vaccinated and not to put themselves in jeopardy, nor infect their families and loved ones. Again, I implore all persons to take the COVID-19 vaccine. Thank you and good afternoon. I will now take questions from the media. We'll begin with Rustin Jones.
Good afternoon, Dr. Dahl-Regis.
Good afternoon.
And to the Bahamas. I understand you used a reference period, I think it was mid-August or July and August, for the number of COVID-19 cases and deaths. And there were 52 deaths and 51 of them were unvaccinated. Has that study been expanded to recognize whether there have been any hospitalizations or any deaths of any fully vaccinated period in the Bahamas at all?
I'm going to ask Dr. Nikia Forbes to respond, but the data are from March. If you go back to that slide, it's from March to July. But Dr. Forbes, are you? Dr. Forbes?
Good afternoon, all. Yes, thank you. So, Mr. Jones, that information is for the Princess Margaret Hospital from the start of the rollout of the COVID-19 vaccines until the 31st of July. And we are collecting this data on an ongoing basis. And that's the most updated version of this information I have at this time. We're continuing to review this. And I can tell you that based upon the data we have, that 97% of hospitalized patients hospitalized for COVID-19 are indeed unvaccinated, and no fully vaccinated persons have been admitted up to that time period, and none have died, which speaks to the effectiveness of these vaccines. This information is also being gathered at other treatment sites.
Thank you, Dr. Forbes. Rushton, I know you would have another opportunity, but is there a follow-up for that question? If not, we'd go to Karen Bain from Freeport.
Good afternoon, Dr. Dahl-Regis. Good afternoon, Bahamas. Karen Ferguson Bain, Global 99.5 FM. Dr. Dahl-Regis, you mentioned that additional slots were opened in New Providence. My question is in regards to the residents of Grand Bahama who are challenged and are growing frustrated with the inability to book their appointments online, some of whom have been trying for days and weeks, however, to no avail. How is the Grand Bahama site being managed to accommodate the increase of demand of residents of this island?
Thank you, Ms. Bain. And with your permission, I'd ask our data consultant, who's responsible for all the good data that we have, to speak to you. Dr. Davis, please.
Good afternoon, Bahamas. Thank you for the question. In regard to Grand Bahama, we're currently engaging the center at Grand Bahama now to seek to open an additional spot. We recognize that there is increased demand, and as we're doing in Nassau, we are also looking to open an additional site or increase the throughput at Grand Bahama. So I would say to you that we are responding in real time to this call for additional services and doses available in Grand Bahama. Thank you.
Tyler Simonet.
Good afternoon, Dr. Dahl-Regis, and good afternoon to the Bahamas. I understand that you said you will not be offering a third dose of the vaccine at this time, but do health officials recommend at any point that the public get a booster shot of Pfizer or Johnson & Johnson? Should it be made available? I know some of the public may feel like they want that extra level of protection, but do health officials feel as if it is necessary at this time?
We anticipate that as we follow the variants and particularly the global literature, we would follow those recommendations. At this time, there is some recommendation for the immunocompromised individual, which means that should someone be so identified, we would certainly make a consideration of administering the third dose. Not everyone is able to mount an immune response in the time period that we administer first and second doses. Therefore, if that is documented, we would certainly, as a group, recommend a third dose, but not for the public at large at this time. Kishla Adderley. I'm unable to hear you, Ms. Adley.
Is that better?
Yeah, now I can hear you.
Okay, great. Well, there are at least 2 choices available to Bahamians for the vaccine, soon to be a third. Will we have a choice, or members of the public have a choice in which they take? And if so, how will that be managed?
Yes, yes, in the management of the vaccine, probably I would ask Dr. Davis to share with you how it's set up at this time. Dr. Davis?
Thank you. In regard to management and what choice you have for a vaccination, we are setting up, as Dr. Dahl-Regis said, this week we'll be continuing with the AstraZeneca vaccines. When we move into the Pfizer vaccine shots, one site will remain open in New Providence. That site will be the Church of God site. That site will allow us to continue to administer those second dose individuals for the AstraZeneca vaccine. If an individual is inclined to have a Pfizer shot as their second dose, we invite them to make their appointment for the second dose, not at the Church of God, but at one of the other sites. That way, as Dr. Dahl-Regis said, we will be able to administer a second dose. That second dose will complete their vaccination and we'll be all good. Thank you.
Similarly, when we have Johnson & Johnson on island, we would publish where, which site you can make an appointment for that. Giorgio Bain. I'm unable to hear your question. Can I go to Farah Johnson?
Good afternoon, Dr. Dahl-Regis. We know that the Pfizer vaccine must be stored in ultra-cold temperatures at all times. I know earlier in your presentation, you spoke about the safe and secure transportation of the vaccines, but is there a backup plan in the event of a power outage?
I can describe to you what we currently have and the security. We not only have the stand-up freezers with the capacity that exceeds the number of doses we expect to have, that are monitored very clearly off-site. There's a backup generator for power failure, and we had to make the adjustments to 220 voltage. We also had to make another adjustment because the compressors were generating quite a bit of heat, and we had to reinforce the air conditioning for the site, the place in the storage site where the freezers were. They're the standard freezers. We have 6 portable freezers that reach minus 80 degrees. They hold 9,000 vaccines each. Further to that, we recently reviewed the revised recommendations from the Scientific Advisory Group of Experts that now tell us that once the vaccine is thawed out, if the vaccine is thawed out, it can remain viable, safe and secure for 30 days in a refrigerated temperatures. We have the capacity to transport with the portable freezers we have on the various islands freezers and refrigerators. What we must secure are backup services such as working generators, because we cannot afford to lose any vaccines. But we've tested it now, and all is working in terms of the security of the cold chain. Do we go back to Giorgio Bain or we go to Crystal Brown? Crystal Brown, please.
Good afternoon, Dr. Dahl-Regis. My first question is, what percentage of healthcare workers in the Bahamas are vaccinated for COVID-19? You just mentioned nurses that either have died or have contracted COVID-19. So just wanted to know how much of a concern is it? How concerned are you about the numbers of healthcare workers in the Bahamas who are not vaccinated?
If you would permit me, I don't think, Dr. McMillan, do you have those figures? Mm-hmm.
Good afternoon, Bahamas. Most recently, we reviewed the data as it relates to healthcare workers that would have been vaccinated based on the population, the amount of the population that we anticipated to vaccinate in our target group when we were planning to do the vaccination rollout. And what we found was that that was just over 20%. So we are, I would say, we have a long ways to go, and certainly there is grave concern as it relates to getting healthcare workers vaccinated. I think Dr. Dahl-Regis would have just shared with the Bahamas some news that was very disturbing, and we must, colleagues, we must become vaccinated.
Ms. Brown, I'd like to invite you to ask your second question, please.
Thank you so much. What is the policy related to vaccinations with, what is the policy related to, sorry, that's my TV in the background. I just wanted to find out the policy of vaccinations as it relates to migrants in the Bahamas.
We vaccinate all persons who present themselves with the respective credentials. Okay. Farah Johnson.
Yes, good afternoon again. Is the Ministry of Health minded to partner with private healthcare facilities so that they can also administer vaccine doses?
The answer is yes. The National Consultative Committee certainly has thought about this and will welcome participation with the private sector, provided we can guarantee that the vaccine storage is secure and the administration is safe and the data gathering is part of the national effort to collect information on our citizens and residents. Keishla Adley, please.
Yes, I wanted to ask a second question, and I hope if I can refer to the question I asked earlier that I needed some further clarification on. But some questions have emerged about what qualifies as an approved vaccine. There's been some information circulating among insurance companies about what will happen in the event that someone is vaccinated, not vaccinated. What constitutes or who determines what is an approved vaccine?
Excellent question. At the outset, we set criteria for approval of vaccines. recognizing that many would be, you may have many offers, but not all gifts achieve the same thing. We, as a group, collectively, the Bahamas, the Ministry of Health, together with the Pharmacy Council and its group, and the CAFA, the Caribbean Association, Caribbean Public Health Agency, we all agreed that the vaccine must come from the manufacturer, not from a middleman. The vaccine must be approved either by a national stringent regulatory authority, in addition to receiving the equivalent of an EUA or an EUL, Emergency Use Authorization by the FDA, that's given in the US, or Emergency Use Listing by the World Health Organization that partners with the EUA. We also must have vaccines that are not expired, that must have a date, an expiration date, a shelf life of at least 3 months from the manufacturer to the expiration date, that it must meet all the transportation requirements of that vaccine. They have vaccine monitors inside the shipping establishments that tells you if the vaccine has met all of the cold chain requirements at each and every stop. Did I leave out anything, Dr. Macmillan? I think I covered most of the hard. There's no soft criteria here. They're hard criteria. So, Ms. Adderley, we have not used any vaccines in country that have not met those requirements, although we have been offered many. I think Dr. Macmillan can add something to this.
Thank you, Dr. Dahl-Regis. Certainly, I want to correct what I said a few moments ago. It's just over 50% of our healthcare workers that are actually immunized. I did a cross-check. It was just 20% of the 60-plus age group, and it's 50% of our healthcare workers that are already immunized. As it relates to the process that the Ministry of Health actually goes through to ensure that our vaccines are safe, many may realize, many may recall that we actually had a piece of regulation or legislation that spoke to a requirement for the Ministry of Health to actually provide an approval certificate. The Office of the CMO, along with the pharmacy regulatory person in the ministry, Dr. Gina Archer. What we do, we work closely with the Caribbean regulatory system, where they actually do a review of any vaccinations that are potentially coming into the country, and they would need to provide us with a certificate of sameness to ensure that what the particular manufacturer is sending to us is exactly what they are saying that they are going to send to us. And we do not entertain any vaccinations that have not already gotten emergency use authorization. So we have a stringent process that we go through to ensure that before a vaccine comes to the country, we are, I would say, very, 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 almost 100% sure that these vaccines are safe to come and to be used in our population. Thank you.
Ms. Adley, that's such an important question that you raised. We have an import license that is issued after all these checks are made. You have to satisfy an import license. Now, I say it's an important question because the public should know that vaccines that they may be offered may not meet the requirements. You must have a batch number, a date of manufacture. There's a list of regulatory requirements for you to get that import license. So the public need to be aware that at this time, the vaccines that are brought into the country meet all of those standards. Thank you for that question. Tyler Simonet, please.
Good afternoon again. Giorgio Banchi said her microphone is not working. Would it be possible for me to ask her question and also my question?
Surely we can accommodate that.
Okay, thank you so much. So Giorgio's question is in regards to the baby, the young newborn who tested positive for COVID. She wants to know, is the baby still alive? How are they
Yes.
treating him or her? And is the mother COVID positive?
Yes.
Yes to all
of that, yes.
Okay, well, thank you for that. And my question is, how will these vaccination sites, especially ones that are walk-ups, how will they be able to ensure that people who are not currently fully vaccinated with AstraZeneca will not double dip or triple dip per se by getting the Pfizer or Johnson & Johnson?
I'm so happy Dr. Davis is here to answer that.
So the data management system that we've used to record all the vaccinations in country will, of course, capture your particulars, and at that point there we'll recognize and the system will alert us that this person is presenting for a third dose. Recognize that it may come to that point where this may be an option for us, but at the end of the day, we are configured today to ensure that the supply that we have is distributed such that everybody gets a first and second dose before we start to entertain a third dose, other than those conditions that Dr. Dahl-Regis described earlier. Thank you.
Thank you again, Tyler. Tyler has asked a question. She wants to ask her own question. She asked Giorgio a question, or you already completed, Tyler?
Oh.
You done?
Well, the question about the, I mean, I could ask another question if you want me to.
No, I don't.
No, my question was answered. Thank you.
Okay, but Tyler, in terms of the question that you asked begs a response that I think we need to really salute Dr. Davis, because if you read on social media that this person was vaccinated, we have ready access to a database to prove or disprove that. So when we say to you that the healthcare workers, all four, were unvaccinated, there is no information in the database that we have that they were. Okay, Karen Bain, please.
Good afternoon again. Thank you, Dr. Dahl-Regis. My question is for Dr. Nakia Forbes. At the onset of the pandemic, the Ministry of Health spoke highly about herd immunity. To date, what is the percentage needed for herd immunity in the Bahamas, and how far are we from that target number?
That's a very good question. So experts' consensus is that you need between 70 to 85% of a population immune for herd immunity. And so if we have a population of about 400,000 and we have fully vaccinated about 56,000 persons, you'll see that we've still got some ways to go as it relates to this target of having 85% of the population immunized. It is very important that we have a high vaccination coverage, because we do know from emerging evidence that being vaccinated will be very effective to prevent getting COVID-19 infections. Even though it is possible to have breakthrough infections, it's not the usual rule. I would say we've heard that less than 5% of infections in the Bahamas to date are breakthrough infections. And we know from international data as well as our data here at home that being fully vaccinated goes a long way to protecting against hospitalizations as we have seen, and deaths. So I thank you very, very much for your question. I would say at the Princess Margaret site, vaccinations have 100% protected from COVID deaths to date. So it's still a very, very important number that we reach for. But I also want to state that the virus is changing, and we can see that there are places that have higher immunization coverage rates that are having resurgence. And that's for a number of reasons. In those cases, too, many of those persons have been unvaccinated, and we have to remember that we have to combine the vaccinations with following the public health precautions. So it's very important that we get this data here at home. And I want to commend the team at Princess Margaret, Dr. Hilary DeVoe, a very, very great doctor that primarily put together this information. And we have to describe this in our context. We know that vaccinations and following the public health precautions, mask wearing, are effective to protect against deaths. That's what the science is showing us here at home. But thanks for your question.
Rustin Jones.
Thank you again. Just as an observation, considering that someone has to register, if they get a shot, a vaccine abroad, and they have to register domestically, they could get a first and second shot in the Bahamas after getting a shot abroad and get 3 that way. But that's not my question. I was just thinking about that. I know what you said about consideration for a third dose for immunocompromised individuals. Israel's been offering COVID boosters to people over 60 who are fully vaccinated, and the US appears to be or approving the same given the threat of Delta and the low breakthrough infections among vaccinated people. Is the committee exploring a third shot for the elderly in the Bahamas to better protect them against Delta?
Not at this time. We wish we had the coverage that Israel had. We wish we had the supply of vaccines that everybody else, like Israel, has. We are now the committee is gratified that we don't have a supply issue at this time. The other concern of the committee, before we go back to the 65 vulnerable and above vulnerable population, we are anxiously monitoring access to COVID-19 vaccines for the under 12. And we would like to be in line as soon as that becomes available to have that accessible, because as you heard, herd immunity is for the population, not for selected groups. And based on the experience here, as I shared with you, with the newborn, we really, there's a significant gap in that under 12 population and access to immunizations. I'd like to conclude this press conference at this time and thank you for your attendance.